clinic manager, here to talk to us about dental health, vaccines, overall health, and what we can be doing to take better care of ourselves. Welcome, ladies.
Thank you.
Thank you for having us.
Yeah, thank you guys for being here. So it is, we're talking dental health and vaccines, and it's kind of interesting because I don't think I've ever got a vaccine at the dentist.
Most places don't have them. We're like really the only dental clinic in Michigan that offers it. We're
Really?
a pilot program through MPCA, and we've been doing really well since June, getting people in. We've got about 85 vaccines under our belt so far, so
Wow.
it's been great.
That's fantastic. How can people, how does it happen? Do you have to sign up online? Do you make an appointment?
So we have patients that come in, and those patients are eligible for our vaccines when they come in. We always ask them when we're rooming. So if they need a flu vaccine, or if they need a COVID vaccine, or an HPV vaccine, we can offer those to patients when they come in.
So I need to have my teeth cleaned, and I'm behind on my
Yep.
flu shot. I can just do it all in one
Yep.
appointment?
Most patients really like that. They do one-stop shopping.
So who should get vaccinated?
Well, for flu and COVID, we vaccinate from 6 months on up.
Okay.
And HPV is about 9 to 11 on up. So
Okay.
we can do that there.
Tracy, you don't hear a lot about receiving vaccines through the dentist. Talk about why that's so important to kind of your overall health.
Well, for the center, we just want to be as available as we can to our community, and that not always do folks come to our medical clinic, but a lot of times they will come to our dental if they're in pain. So that gives us that opportunity, an additional opportunity for our patients to get the vaccines. The HPV specifically is important because many years ago it came out as a vaccine for cervical cancer, but now that we've had it this long, it's less about cervical cancer and more about head and neck, throat cancer for especially our kiddos. So we do offer that as well, of course, on the medical side, but in dental, it's a perfect opportunity to have that conversation with patients about the importance and with their parents if they're there, and get that started for them as well.
So what all vaccines do you offer at the dental clinic?
In the dental clinic.
Yeah,
So we
in the
offer
dental
flu,
clinic.
COVID, and HPV.
Okay.
So
All right, it's flu season.
Yeah, it is.
Is it
Flu
too
season.
late?
nope, it's not too late. We're getting a lot of them right now. I think people are realizing it's getting to the time of year where sickness happens.
Tracy, what's the best way to get a flu shot at the center?
Well, we do walk-ins in our walk-in clinic also, but you can get them at your regular appointments if you're a patient there. You can get them at the dental office. We try to make it as convenient as possible. You don't have to be a patient at the center to get a flu or COVID vaccine. So.
Oh, nice. And so if I have an appointment, and I can just add it on when I get there?
We're going to ask you. You don't have to worry
Oh,
about
good.
having to ask.
Good.
We're going to ask you when
Good,
you get there.
Good.
Yeah.
So what you guys do is so important to the community, and we're watching your services grow. What are you guys most excited about for the future of the Center for Family Health?
I don't know. There's so many.
question.
I know there's so
Right.
many things
It's
that
been
we're
one
always-
good thing after another, it feels like, for the Center for Family Health. It's been awesome. New walk-in clinic, Brick Award the other night.
Yes.
It's been
We
great.
did, we
It's been
did.
awesome.
Our drive-through for our pharmacy is really great. It's a great
Yeah,
access
and
for patients that can't get out of their cars.
And I think it's
that's
important for people to know that anyone can use the pharmacy.
Anyone.
Anyone.
Yeah, they don't
Anyone,
have to be a
anyone,
patient.
You can make it your preferred pharmacy.
Yeah.
Yes, you can.
Absolutely,
Yes.
you can. And we do have new providers starting. We just had another OBGYN that started. We
Wow.
started the centering program, which has been, we've had one group. It's been super successful. It's just a different model of prenatal care. It's more of a group setting, and some of our pregnant patients prefer that. You know, a lot of support there. So we've just started that, and so we have another one coming up this month, and so we're hoping to increase that as well.
I think it's so important. You guys are so accessible. Everybody can get to you. You're right in town. I love that we don't have a pharmacy. We didn't have a pharmacy downtown. So it's so great that you guys are bringing the services to everybody.
And the
that needs
drive-through. I mean,
Yeah,
especially,
that's
you look
huge.
at the weather we're having today,
Yeah.
right? No one wants to do anything outside.
No, and if your kiddos are sick, you're not going to want to
Right.
bring them on
them out.
in. You want to keep them in the car with their.
And you guys have a lot of the same drugstore style products that you can get at very reasonable prices right inside your pharmacy.
Yes, absolutely. Based on the program, because we are an
Yeah.
FQHC, we
Yep.
can a lot of times offer medications and those over-the-counter things at a rate that's lower than regular.
I did not know that.
Yeah, we've got-
for sure.
Yeah, we've got
Yeah.
a couple shelves of over-the-counter medications. And it's really
Yes.
great for patients that come in. They can stop and get their prescriptions and then get the
Yeah.
over-the-counter stuff that they need.
Let me go back to the vaccines. I want to ask you, Amy, how do those vaccines impact your actual oral health?
So HPV is a big one for mouth and throat cancer.
Okay.
And that is kind of how we encourage patients to get that. You know, the sooner we get that, the more covered we are in the future. So that's definitely helped. But we do we do see a lot of patients that come in with head and neck cancer and have to help them along on their path. So it's really nice to be able to see some prevention with that. And of course, like flu and COVID, your symptoms are going to be coming, sore throats, stuffy nose, colds, all that medication that you're taking can affect your mouth and teeth and not make you feel very good. So it's good to stay healthy, and it helps prevent spreading to others and all that kind of good stuff. So.
Awesome. Well, thank you guys so much, and thank you guys for braving the cold. And although all schools are closed today, the Center for Family Health is not closed. They are open, of course.
They are open.
Thank you guys so much for being with us.
Thank you.
Thank you.
From the Center for Family Health, Tracy Van Buskirk and Amy Ward. More of the show right after this. Stay with us.